Hi, my name is Manisa Akbar. Today I am going to talk about peanut allergy counseling. It is one of the scenarios which can come in the NACOSCE stations. Usually the patient is a child who had some reaction to peanuts and now the parent or caregiver are here for the counseling. To approach such cases, we start off with the introduction and taking a brief and focused history. After that, we can go ahead with the counseling and explain to the parent or caregiver about the sign and symptoms of peanut allergies, what causes it, what are the risk factors, how they are diagnosed and treated, and what can be done to prevent it in the future. I start off with history by introducing myself that hi, I'm Dr. Vanessa. I understand that your son Henry had some reaction to peanuts. Can you tell me more about it? Then I'm going to explore this chief complaint and ask about the onset of symptoms, the course duration, any aggravating factors, alleviating factors, any other symptoms associated with it. I'm going to ask about the past medical history of the child. Then, is he on any medications and allergies to food, drugs, or anything else, as well as the family history of allergies to peanuts or any other histories. After the initial history, we go ahead with the counseling. We start off by explaining a bit about peanut allergy. That peanut allergy is the most common form of serious food allergies in kids. Most of the kids develop it in their childhood and it continues throughout their life. However, 20% of them can grow out of it as they become older. But the kids who have severe reaction called anaphylaxis are less likely to grow out of it. As far as the sign and symptoms are concerned, they can range from skin reactions like hives, redness or swelling, mm, itching or tingling in and around the mouth and throat, to respiratory symptoms like runny nose, tightness of throat, shortness of breath or wheezing, to digestive symptoms such as diarrhea, stomach cramps, nausea or vomiting, and in some cases, severe reaction called anaphylaxis can occur. In fact, peanut allergy is the most common cause of food-induced anaphylaxis. In this condition, there is swelling of lips, tongue, and throat, constriction or narrowing of the airways, which makes it difficult to breathe. It can lead to a severe drop in blood pressure, rapid pulse, followed by dizziness, lightheadedness, or even loss of consciousness. Fortunately, such reactions are rare. After this, we explain to the parents that why is it happening. So, the peanut allergy occurs when your immune system mistakenly identifies peanut proteins as something harmful. Exposure to peanuts can occur in various ways. It can occur either as direct contact, cross contact, or inhalation. The direct contact is the most common cause of peanut allergy, which is by either eating peanuts or peanut containing foods. Sometimes, even direct skin contact with peanuts can trigger an allergic reaction. Cross contact happens in the unintended introduction of peanuts into a product. It is generally the result of food being exposed to peanuts during processing or handling. The inhalation can happen from a source such as peanut flour or peanut cooking oil. Now, the risk factors. Now, it's not clear why some people develop allergies while others don't. However, there are certain risk factors mm, which, if you have, there is a great chance of developing peanut allergy, which include age. Food allergies are most common in children, especially toddlers and infants. As they grow older, their digestive system matures and body is less likely to react to food that triggers allergies. And then is past allergy to peanuts. Some children with peanut allergy can grow out of it. However, if even if they grow out of it, it can recur. Other allergies, if you are allergic to one food, then there is an increased risk of becoming allergic to another one. Likewise, having another type of allergies like hay fevers can increase your risk of having a food allergy. Family members with allergies Kids are at increased risk of peanut allergy if other family members also have such allergies. And the last condition would be the atopic dermatitis. It is a skin condition called eczema, and if a person has this condition, they are more likely to develop allergy to peanuts. After explaining the initial sign and symptoms and describing the causes and risk factor for peanut allergy, we will go ahead with the management plan and explain to the parent that the next step is to confirm the diagnosis of peanut allergy, and for that we are going to send Henry for a skin test and a blood test, and I'm going to refer Henry to an allergist for that, and for the skin test. And for a blood test, the blood test will measure the immune response to particular foods by checking a specific type of antibodies in the bloodstream known as IgE antibodies. Once the diagnosis is confirmed, um, the treatment for this condition would be one is the antihistamines, uh, which are medications which can reduce mild symptoms of peanut allergies and are taken after exposure to peanuts to relieve itching or hives. And the next treatment modality, the epinephrine, is for patients who have the severe reaction called anaphylaxis. And this is a device which is as a syringe and concealed needle which injects a single dose of medication which is when pressed against the thigh, and it is used on the first sign of anaphylaxis. There are some other therapy called immunotherapy, and the drug is Palforizza, which is a treatment for people with confirmed allergy to peanuts, and it can help to reduce the severity of allergic reaction which can occur with accidental exposure, but this drug is not available outside the US. Unfortunately, there is no cure for peanut allergy. The only way to prevent a reaction is to avoid peanuts and peanut products altogether. But peanuts are common, and despite your best efforts, you are most likely to come into contact with peanuts at some point. So, in this case, it's really important to read all the food labels for peanuts, avoid high risk situations like buffets, ice cream parlors, unlabeled candy, and desserts, and use a written plan. List all the steps that need to be taken in case of an allergic reaction, including the order and dose of medications which are to be given, as well as the contact information for family members and healthcare providers. Uh, Involve the caregivers, ask relatives, babysitters, teachers, and other caregivers to help. Teach the adults who spend time with Henry how to recognize the signs and symptoms of an allergic reaction to peanuts, and emphasize that an allergic reaction can be life threatening and requires immediate action. Um, Now, it's common for kids at school or even daycares to share snacks and treats. Encourage him to avoid sharing his food and not to eat from others as well. Now, you have to make sure that the epinephrine auto injector is always available, uh, because an injection of epinephrine can immediately reduce the severity of potentially life threatening anaphylactic reaction, but it needs to be given right away. Now, make sure the Henry School has a food allergy management plan. Staff should have access to and should be trained in using the epinephrine injector, and it's also important that Henry should wear a medic alert bracelet. This will help make sure that he gets the right treatment if isn't able to communicate during a severe reaction. The alert will include his name, type of food allergies, and may also list brief emergency instructions. I will give you a prescription of EpiPen and a brochure which has further information about peanut allergies. Do you have any questions or concerns?